Hi, I'm Nikila, working at VDC. Hi, sir.
Hi, madam.
Every dentist have many doubts in their mind when it comes to implantologist. So we have done a survey and I have gathered few of the questions which I want to ask you.
Definitely.
What is an implant and its types, and what are the materials used in implants?
Implant is an artificial material which is placed in bone to replace the lost tooth, and there are different type of implants. They are like two-piece implants, single-piece implants, zygoma implants, and pterygoid implants. And coming to the materials used in the manufacturing of these implants are usually in starting days, titanium is the one material which is used for manufacturing implants. Nowadays, for cosmetic purposes, where the titanium is a metal, the look will be little bit odd for the titanium implants. To correct this aesthetic purpose, these titanium implants were replaced with ceramic implants also, which is advanced technology nowadays.
How do implant material affects osseointegration and long-term success?
Nice. Usually titanium material is the ideal material for osseointegrations. For a long period of time, titanium implants provide very good osseointegrations with the bone. In recent studies, ceramic and zirconia implants are also giving good stability nowadays.
Sir, what are the different implant placement techniques?
Yes, there are two type of implant placement techniques. One is by opening the flap, we will do the implantation, and the other technique is flapless. The difference between these two is we need to open the gum with the blade and open the we should see the bone and we should place the implant. This is called flap technique, which another technique is called flapless technique, where we need not to cut the gums, directly we can place the implant into the bone. This is called flapless technique.
Sir, how to determine the implant position and angulation?
Yeah, the position and angulation of the implant, it varies. There are so many factors which comes into the action. It depends upon the bone quality available and how many number of implants we are going to place, and are we going to replace a single tooth implant or multiple tooth replacements. These are many factors are there to determine the position and angulation of the implant, where in few cases the bone density will be very less, so we should take the support from the upper level of a bone. In that scenarios, the angulations will be different. If there is a nice amount of bone available, the angulations will be different. So these factors, the bone density, how many number of implants we are going to place, are we going to place single tooth or multiple tooth, these factors will determine the position of an implant.
Sir, when is bone grafting necessary?
Yes, there are different type of bone grafts available for reconstruction of the bone. It is like the three types are autograft, allograft, and xenograft. In these three, autograft material is the highly appreciable graft. Why? Because it is taken from the same bone, same patient. Whereas autograft and xenografts, there are artificial bone grafts where the take up of the bone for xenograft and allograft is little bit less. Autograft material will bone take up is very good.
What are the different types of bone grafting materials and techniques?
Yes, for doing implants, assessment of bone is very important. Why? Because the bone is the main structure which is going to hold the implant. Assessing of the quality and density is very important. How will you do is just with the help of radiograph or with the help of CBCT, we are going to analyze the bone quantity and quality. In radiographs, we can clearly appreciate what type of bone is present. Okay, and in CBCT, with CBCT and with radiograph also, we can analyze which type of bone is present, either it's maybe type 1, type 2 or type 3 or type 4, and we can clearly see the density of the bone in these radiographs, because radiographs are the crucial diagnostic tools which help in determination of the density of the bone, which is a key factor for implant success.
What are the treatment options for failed implants?
Yeah, once implants is failed, what next is a big question in the doctor's mind. If there is a failure of an implant, then one thing we can do is first retrieve the implant from the osteotomy site. Once the retrieval of the osteotomy site is done, then curate the osteotomy site properly with antibiotic and with betadine, and then selection of another good size implant and reimplantation is the ideal treatment for a failed implant. If at all the bone density is very less, use a proper autograft to increase the density of the bone and do reimplantation. This is the only option which is left over for a failed implant.
How to prevent and manage implant failure?
Yeah, failure is a big word in implantology. Okay, we all know. How to prevent it? How to prevent it and how to manage it? The failures. These are the very big tasks in an implantologist's hand. Prevention. How to prevent an implant failure? For any implant placement, antibiotic coverage is very mandatory to avoid infections. Okay, and the other thing, next step is in the surgical procedure, selecting of a proper drill for osteotomy and selection of a proper implant is very crucial for implant success. If we go wrong with this selection, there are chances of getting failures. If at all you encountered with a failure, for an example, you encountered with the rotation of an implant, then how you should manage it? Simply, we should take a little bigger size of an implant and place in the osteotomy site. Or if you are facing any infection post-operatively, cover it with antibiotics. Okay, and proper post-operative instructions like maintaining of good oral hygiene and instruct the patient not to smoke. These are the very important things after post-operative implant placements. This will definitely reduce the implant failures post-operatively.
What are the common complications in implant placement and restorations?
Yeah, this is very good question. Complications. There are two different type of complications in implants. One is when you are placing an implant, you will get few type of complications, and post-operative and after the placement of implants you will get few complications. What are the complications you will get while placement of implant is usually you will encounter little bit heavy bleeding, and you may encounter with the nerve. You may just reach the nerve or you may damage the nerve. And the other complication is there are chances of bone fracture. If you are not proper with the drill, there are chances of getting bone fractures also. And the other complications which will is you should be very careful while placement of the implant. You should not damage or injure any surrounding structures like tongue or cheek while placement of an implant. These are the complications which commonly we will execute while placement of an implant. Other complications which we will get after placement of implants is usually the common complication is swelling, and the other thing is pain, which we can be managed with medication. And the other complications are sometimes you may get hematoma, or sometimes you may get paresthesia, or sometimes you may feel that the implant will pop out from the socket or an osteotomy site, which is caused due to peri-implantitis. Okay, these are the few post-operative complications and the common complications which we will see after the implant placement.